Here to discuss our recent Morbidity and Mortality Weekly Report, MMWR, concerning an outbreak of E. coli 0157H7 linked to the consumption of cannibal sandwiches, is Dr. Abbey Canon. Dr. Canon is a veterinarian, a public health service officer, and she's with the Epidemic Intelligence Service Office of the CDC. Hello, Dr. Canon, and thanks for talking to me today.
Hi, thanks for having us this morning.
Perfect. Well, let's go straight to the MMWR report. In early 2013 in Wisconsin, a couple of cases of E. coli 0157H7 were detected, and based on laboratory analysis, they were considered identical strains. So what happened from here, and where did your investigation take you?
Sure. Well, I'm glad you asked a little bit more of the details because there's only so much you can put in an MMWR.
Right.
So what happened last year, it was right after Christmas, Christmas and New Year's, and we had the lab, our Wisconsin State Laboratory of Hygiene, notified us, the Wisconsin Division of Public Health, that we had these two matches that, by laboratory analysis, like you said, matched for E. coli 0157H7. Now, when we have foodborne illnesses in Wisconsin, it's very typical and standard to do a food history interview with patients. So the local health department will receive a report from the clinic or the lab that a foodborne illness has happened, and in this case it was E. coli. So those local health departments immediately, and I think within one day of both reports, they had interviewed both cases, both ill patients, and had found out that they had both eaten raw ground beef in either a tiger meat or a cannibal sandwich, which are the same thing, just called different things.
Okay.
And so that was definitely a red flag. On the food history interview, we ask things about what you've eaten, where you've eaten at, any restaurants, what grocery stores you shop at, any animal contact, things like that. And this, having people say I ate raw ground beef was definitely a trigger for us to investigate further.
Sure. And now this is the first I've ever heard of this tradition called cannibal sandwiches. It's a holiday tradition up in the northern Midwest. How long has this been going on? And do you see cases every year because of this tradition?
It sounds like it has been going on for a very, very long time. In Wisconsin, It's centralized around that Milwaukee area, but we've heard reports from North Dakota, South Dakota, kind of all over the upper Midwest. But we have, as the Wisconsin Division of Public Health, has had reports of large outbreaks of more than 50 cases, and the previous ones happened to be all salmonella that were reported, but as far back as 1972. So it has been going on for quite a while. And even though we don't have large outbreaks every year, if people are consuming raw ground beef every year, there's likely illnesses associated with that. We just don't always hear about it.
Okay, in this particular outbreak, what were the final numbers as far as the amount of people infected?
Sure. In this outbreak, we had 4 confirmed cases, which that just means that they did go to the doctor, they submitted a stool sample, and the laboratory ran an analysis on it. So we were able to determine that all 4 of those people had the same E. coli infection. And on top of that, we had another 13 people who had a very similar illness and were also considered cases, but probable cases because they didn't have that laboratory confirmation. And then we had an additional 11 or so patients who were also ill that we just couldn't quite fit into our case definition. But as far as we're concerned, those individuals are more or less part of this outbreak too. And you have to remember too that those are only the people that we hear about. There are almost always many others that don't go to the doctor, that don't let public health know, that there's just no way that we would know about them. So at least 17 and likely quite a few more.
Right. And you traced this tainted ground beef to a particular market.
That's right. All persons that we talked to and all ill persons purchased the same ground beef from the same market, and most ate it raw. Yeah.
Now, this part is absolutely the most fascinating thing that I got out of the report, was you administered a questionnaire. And I'm going to quote right out of the MMWR. Among respondents to this questionnaire, 98% reported consuming raw ground beef, only during special occasions or winter holidays. Of that, 91% were aware of that consuming raw ground beef could cause illness. But then it goes down to there's still a large percentage of them that say they will continue to eat raw ground beef in the future. Now, to me, that's astounding. And you would think after all the publicity, especially concerning E. coli since the Jack in the Box incident, a couple decades ago, people wouldn't dare consider eating uncooked ground beef anymore. So how do you get people to understand that this is a dangerous practice with serious health implications?
That's right. It is a very dangerous practice, and it does have potentially serious health implications. And that's one of our challenges, is getting that message out. That was one of the reasons we did ask that question, is we wanted to know why people, kept up with this tradition when there has been information out there on the dangers of consuming raw ground beef, of E. coli and salmonella and other infections. But also in 1994 with that outbreak, a similar question was asked, and 85% of those patients, the people that were sick, were aware of previous outbreaks associated with raw ground beef consumption, but they still ate it anyways. So there's an ongoing challenge that we have to address that. And a few of the other questions we asked, gauge the severity, their understanding of the severity of illness, and that was potentially an area where we can step in. A lot of people said things about, leaving it out on the counter too long or not refrigerating it properly. I think somebody said something about it's like leaving anything else out on the counter, just like potato salad. And that's not quite the case. That certainly increases risk, but the risk starts at the very beginning. In consuming raw ground beef and not cooking it at all, there is a risk, and it is potentially very serious and sometimes fatal too, the infections.
Right. And it's the holiday season now. Are you seeing anything this year?
We have not yet, and we sure hope not to. We know it's a tradition. We know we're not going to change everybody's mind, but if we can at least get the message out, again, at this time this year and remind people that it can be a very dangerous practice to do. And one of the other things, too, that's really important to highlight is that a lot of people, when they're talking about a tradition in their family, they would talk about feeding it to their kids, their young children, and that group can be even more at risk for serious complications of E. coli and other infections from eating raw ground beef.
Yeah, and that's how I'd like to close this interview with Dr. Canon. Can you just briefly talk about E. coli 0157H7 and its pathogenicity, the disease it causes, and how serious it can be?
Sure. E. coli 0157H7 is a little bit different than the other E. colis. There's animals, especially ruminants, cattle, small ruminants, sheep, goats, deer, elk, all carry E. coli in their digestive tracts, and it's not uncommon to find that. But 0157 is part of a group that can cause illness, that are pathogenic to people, and it usually causes stomach cramps, diarrhea, can often be bloody diarrhea, and that can be in the form of a mild illness at the beginning, but it can certainly progress to very serious illness. Like I said, bloody diarrhea and a hemolytic uremic syndrome, which is a form of kidney failure that can result in death without treatment. Yeah, I think it's important that everybody in my website and internet, my radio show audience knows about that. Well, I appreciate your expertise. I've been talking to Dr. Abbey Canon. She's a EIS officer with the CDC. Thanks for your time today, ma'am. Thank you very much. You bet.